Welcome, everyone, to this episode of the Sunflower Palliative Care Podcast, a podcast exploring all aspects of children's palliative care around the world. This is a podcast we started to engage and learn from each other and from our international colleagues in pediatric palliative care. We have a really big, amazing community from all around the world, and this podcast is here to connect us all. We can learn, share ideas, and inspire each other to continue to do this very hard but very rewarding work. My name is Natasha Datoo. I'm a volunteer with Two World Cancer Collaboration, and I'm a palliative care physician at Canuck Place Children's Hospice, as well as a hematologist-oncologist at BC Children's Hospital, Vancouver, Canada. In 2023, the Sunflower Children's Network, alongside various other participants and supporters, started a leadership program that brings together young and inspiring healthcare professionals who are engaged and wanting to provide pediatric palliative care in South and Southeast Asia. Today, we're on our last episode of a series of 4 podcasts where I'll be talking to some of our pediatric palliative care leadership program graduates and participants about some really incredible initiatives they are starting in their home communities. So today, we're hearing from a colleague of a previous podcast invitee, where you previously heard from Nurse Rashini from Nepal. So today, I'd like to invite Dr. Krishna Sharma, who is also from Nepal, to tell us a little bit about himself, and we'll get into some ideas about his project. So welcome, Dr. Krishna.
Thank you, Natasha, for inviting me in this beautiful series of Sunflower Activity podcast. I am Dr. Krishna Sagar Sharma. I am pediatric and adult study specialist. Jump in the pediatric oncology field almost 2 decades, and I am just currently practicing in pediatric hemato-oncology in BP Koirala Memorial Cancer Hospital, Bharatpur, Chittagong, Nepal. This is a government national cancer center of Nepal, having around 500 beds and with the pediatric facility. So my idea to come to the pediatrics is once I'm maybe the first certified pediatric hemato-oncologist in Nepal, but the cure rate is a pediatric population is quite low when I have started my career around 20 years before. So I thought I could help children by palliation care. That's why my mind shift to the palliative care, and it's my passion. And since 2010, I am started to have searching and reading and lots of exposure to training. And 2014, I am able to establish the pediatric palliative care setup here in Bipikura Cancer Hospital, which I am still leading. And we do have both adult pediatric and curative as well as palliative care service in Nepal. This is first kind of such. And I am also involved in both adult and pediatric training modules development for the government of Nepal from last 10 years, and I am the lead trainer for the pediatric palliative care for the government Nepal Health Research, Health Training Center. So in that, I am able to include only few of those topics for all the health worker who come for training. But there is always curious on my mind that why we can start the pediatric palliative care, a separate training for the doctors and nurses.
Thank you so much, Dr. Krishna. It's so nice to have you join us, and thank you for telling our listeners all of the work you do in pediatrics and adult palliative care for Nepal. So, can you tell us a little bit about why you wanted to participate in the Children's Palliative Care Leadership Program last year?
Thank you, Natasha, for this very important questions for me, because as I already tell about myself, I am a pediatric hemato-oncologist, maybe the leading here in treating more than 350 children a year. But at the beginning of my time, I have giving more of the attention to the palliative care, because still in the developing country there are less than 30% children are being cured. So that is more than 70% children require palliative care. So my mind attack in the palliative care since beginning, and I'm just trying my best to establish the pediatric palliative care setup in my hospital almost 10 years, and it is continually running on that way. And at the same time, I have involved in different type of palliative care setup, just like advocacy. I'm also involved in the Nepal Palliative Care for last 15 years and acting as a general secretary of the Nepal Palliative Care. Still, I am holding that post, and I'm just having my post just like national coordinator for palliative care. It is not only pediatric but adults, but when I have able to there is a adult palliative care training modules when it is being reviewed few years back, so I able to negotiate government and the training center at least put some of the topics in pediatrics so that all the palliative care trainer at least they know basic of palliative care in pediatrics so that the same person can give different same palliative care service even the pediatrics. Sometimes they are quite afraid of giving palliative care and taking the children that so that they could help. But that's why I have been here. So there is since then I am just thinking to have the why we can have the separate pediatric palliative care training module. So that's one of the way I am just getting in, and moreover I have lots of exposure mostly in Nepal different palliative care setting, and I do have the exposure in Hyderabad for palliative care training for short time. Even American Society of Clinical Oncology awarded me twice the award for palliative care. So I do have most of the time palliative care. So with that my background knowledge, I just want to have something like leadership post. There is lots of quality required to be a leader, and but though we are clinicians and not much have that much of quality of leadership, I thought this leadership program definitely helped me to build my career, to think positively, to think systematically on the activity and program and project what we have in not only in the hospital, in maybe the national and beyond the national levels. That's why I am very pleased to be enrolled in that global leadership LT program, and thank you all the people who have supported me, taking me on that project, and I am continue learning, and I am so much happy to be the part, and I am learning day by day so many new ideas, new innovations, administration, management, and other coordination like things.
Thank you, Dr. Krishna, for sharing that with us. I think what most of the participants and all of the participants I've interviewed for this series of podcasts have said is it was a way for clinicians to learn more about the advocacy and leadership and how we
Yes.
work with governments to further palliative care in your communities. So, and we're not taught that as clinicians. It's a skill that we all kind of have to learn as we try and advance our passions. So thank you for sharing that. If you remember early on in the program, there was an in-person workshop in Hyderabad, India, where all of the leadership scholars and faculty gathered together. Can you tell us what was particularly memorable about this part of the program? What was the most memorable part when you were together in person in India?
During the meeting, in-person meeting in Hyderabad, I have the chance to have integrate this collaboration and then interaction with most of the global leaders who are working in the pediatric palliative maybe long time, maybe more than a decades and more than 2 decades. So I am very pleased to have that environment to be connected with all the significant international leaders in the palliative. With that one of the area of my memory, but it's give me a lots of in-depth idea and feeling of palliative care and their dedications, their devotions in palliative care, and then trying to help in different community where there is no palliative care. So their passion of work, their motivations, then teachings is quite incredible. So that's one of the very good. And beyond that, being a clinician working a little bit in pediatric palliative care and adult palliative care in the under-resourced country like Nepal, but when we do have most of the clinical things only, but when I went there and lot of series, and then it gives me immense thought and in-depth thought about the how we can think systematically, how we can that the same thing how we can apply the different ideas to navigate the problem, then how we can explore the problem and how we can advocate that problem to further change in the community, like systemic thinking, and then making the project what is doable doable and sustainable project. And then and most of one of the things just like pitch of the problem, just like when we have this we have the pitch elevator pitch like things is very much touch to me, and I just try few. times over there also. This elevator pitch which can give very in very short time attract the donors and the person who are there, and to bring our idea to them, and their attraction to our the project is quite incredible. And definitely there is a, I am more than happy to have the more the peoples globally who can try to help the Nepal or maybe developing country and resource poor country to build a country. So these are the some of my memory which keep in mind, maybe it will last longer in my life. So which give more motivations to work toward the pediatric palliative care and leadership program.
Thank you, Dr. Krishna. It sounds like, and again, a theme that I've heard through this series of podcasts is how that meeting in person really connected everyone. And we make these connections, and our small but strong community of palliative care and pediatric palliative care advocates really enjoyed the connections and the bonds that they formed with meeting other people and learning and sharing together. So I think connection is something I've heard from all of you. That's wonderful. Hopefully we get to meet again in person soon. Can you tell us a little bit about maybe what was one of the most surprising things that you learned during the leadership program?
Yes, surprise. Just like how we can, just like the systematic thinking things, just like maybe what the developed country have already adapted, which can we bring in the developing country and setting, and the advocacies, just like how we can advocate in the resource limited committee, how we can advocate with the government officials, all NGO, INGO, and attract them to our objectives, or maybe our goal of the treating children of the children with the life limiting illness, where we get lots of support. So these are the advocacies, and then again the this elevated pitch is one of the very significant for me, how we can attack those people. I think these are the key memory in I am having since that. So I am just thinking that this is though it is only few 2 days, and that is only the maybe the we have the maybe few people, but it gives me a lot of impression, insight, and thought thought about having this pediatric palliative care as my passion.
Thank you so much. Yes, it sounds like how to think big, think bigger, and taking your advocacy and your passion to government levels was again something quite a few of you have talked about as kind of what surprised you and kind of what kind of fueled your passion during the leadership program. So every leadership scholar has to develop and conduct a project. So can you tell us a little bit about your project? And we heard from Sister Roshani, and I think you're working together. So can you tell us a little bit about the project you're doing?
Yes, thank you for that. So I'm very lucky to have the friend like Rosni in this project, because my project topics just like the development pediatric palliative care training modules for healthcare worker, basically for medical officers, doctors, and nurses. That's is in mind. But when we have been there in Hyderabad, we do have the something smaller thing, just like how to start the pediatric palliative care in one of the hospitals, how to integrate. My idea was how to integrate palliative care in the curative component of the pediatric palliative oncology. That was my project. So Rosni have something to start with the some OPD like things, small things in the hospitals. And I just want to have the integrate, which we have already to separate pediatric, palliative, and curative service, how we can integrate and do that thing. That was what we thought we can do with that thing in the our hospital level, or maybe the one institution level. But when we have been there, it is give lots of insights, motivations, and all the things. Then we thought, and during that meeting, why should not do something bigger, so that it could have the lots of impact to the community, maybe the government level, so that at the same time we can do the lots of advocacy, and we can have something doable things, and which is already required for the country, maybe which I felt during the development of adult palliative care training modules is the need of the pediatric palliative care. So that my in heart feeling was there. Then suddenly during the meetings, the environment, their motivations, and the friend like Rosni, we just together, and we think let's do something bigger. So we just during that meeting we have just changed our project, and we have try to have these things, development of pediatric palliative care training model for healthcare workers. So this is quite big challenge we have. So we just try to have move with that. The Rosni is so supportive, and we were just working together. So we thought initially also we can do it, though it is too hard and takes time. So we can do it. That's that type of motivation given to us by this in-person meeting and the environment what we have got during the Hyderabad meeting. So with that, we move forward, and so far, though there is some sort of constraints, as financial constraints, time constraints, both of are busy in their own works. We are not. We have their own responsibility in the different hospital and other things, but we take our time and we try to move forward along with the project. And so far, we have able to have the multi-stakeholder meeting in the very short time. So we do have a short meeting in the institution levels. We do have the meeting with the government levels, that's the Ministry of Health, and even we do convince the WHO in the country office to for our project. So within a few months, we are able to attract the institution levels and ministry levels, and even the NGO and the WHO country office. They are all think this is the ours and this is the time needed project. So they are very happy to help us, and they have helped us a lot, and we could have moved forward smoothly, though it is little bit a long time, the collecting all the stakeholders around the countries, ministries, and WHO and other supporters takes time definitely, but they have come together. They supported us even further. They motivated us to go along with that project, and in a short time we are able to have the national consciousness to develop the pediatric practical training modules. And then we have conduct series of meetings, different meetings with the help of ministry personals, national health training personals, WHO personnel, and the other pediatric palliative care, pediatric oncologists, nurses, and all who are interested in palliative care. So we bring together all the peoples, and able to have some of the guidelines, approved guidelines, what are the content for the training modules, that also we have finalized. And we can invite some of the people who are already interested in palliative care to have the writing of the content on these modules. And almost we have almost have the zero draft of the content of the 10 minute what we are thought. So it is already in between, and we have already have the zero draft at present, and we are just talking closely with the National Health Training Center, so that our modules, once we have complete, to be incorporate the government system since beginning, so that that model and that training package will take lead by the government of Nepal and through training center, so that that they will took it as their own program in future. So that we have already onboard them, and we have still few more meeting with the technical working group in National Health Training Center. Within a coming weeks, we are going to have the meeting. So there we are going to present our zero draft with them, with the technical working group. Then we can get that lots of feedback. So according to the National Health Training Center guidelines, so we have to make almost three books, just like what the resource guideline. We have to have some participant books, and even the trainers guidelines, like the three different type of content we have to make. So we are working on that, myself and Rosni, we strong hard on these both areas. So I hope within a week we can have finalized some of the content according to the National Health Training Center, so that we can present with them. And even there, beyond that, we can share with the international faculty, so that they will just review our what content we have, and then we are getting the feedback how to improve that content further in between. So for this project, though we are initially lot of travels and lot of constraints we have, but we are just moving forward with boldly. I think we are moving forward, and we will complete sooner. Maybe within a few months, maybe we do have something in our hands with the outcome of that project. And we just try to have on board the different province health training center on our training module. So that is on our next page after the National Health Training Center approve it, or maybe they have recommended it. Then we just want to have on board of the different seven state health training centers officials, so that that project not only central government, it will go simultaneously with the province government, and then they do have their own activity training a health personnel in the pediatric practical. So that at the same time, no, along with these training models, they we are happy to involve in the palliative care strategy of the Nepal, palliative care strategy of the government of Nepal. So I am also actively involved on this development of a strategy for the government. So that is already in the final draft. So what we are looking closely, what is there in strategy and what we are working together. So we try to align the national health palliative care strategy along with our training programs, so that within some very shortly this palliative care strategy will be approved by the government. At the same time, we will come up with the pediatric training manual, so that this will integrate and they will go along with that in the not only central government, even province government, and we just try to have maybe further down few years, you can continue some further, can we take that training package to the local government level, so that all the health worker working in the different areas in the primary care area and district hospital, province hospital, do have exposure on the pediatric palliative care trainings.
Wow, thank you, Dr. Krishna. That's a big and inspiring project. And it sounds like your vision is to have pediatric palliative care for all children of Nepal, whether it's in your center, different provinces. And it sounds like you're working with the government to make that
Yes,
official and have training manual. So
yes.
it's a big vision, and I'm very impressed. As you've been doing the project and going along this journey, can you tell us what you think some of the successes of your project have been so far?
Yeah, thank you. One for and foremost things is motivation from the global leaders in pediatric palliative care. So that's maybe again Hyderabad memory and other connection with the global pediatric leaders like you, so many people. So even we do have, I do involved in the pediatric palliative care training modules during COVID time, along with all the people. So these so many things contribute us to motivated to go forward for me. And other success, just like okay, we are working, myself and Rosni working in almost long time close to the government. So what we are working so far, it is watched by the government, and they government officials, they trust immediately, because what they are trying to do it, I think they will do it. So that's maybe in their mind, so they help us once we have requested them to, we are coming up with that project, let's say you need our help, so all the people are ready to do that. So maybe that other area, maybe we are working the government for a long time in different capacities, so it help us to easy to make, not easy, but it help able to make all the people together. And that, and not third function, maybe the WHO country office is quite supportive, because they help us in one of the two of the meeting, just like stakeholder meeting, and then this export writing comment meeting, like that. So these are the two three meetings we did get some support, financial support, maybe they did their themselves, they supported us for that meeting. And that is one of the area of the success. And still there is Nepalese Asian palliative care, I could not forget about Nepalese Asian palliative care. Myself being the secretary and whole team, they supported me, including chairman and other people, and who are also involved previously in the adult pediatric palliative care, adult palliative care training and developments, and where they have some other people are interested. So we are getting their ideas, their expertise, and their support as well to develop that trend. So Nepalese palliative care is one of the other supporting organizations in the Bignanjo, which are NEPCARES, just like advocacies for education training for the in the country from last 15 years. So this is on the other success for us. And yeah, these are the success. And this National Health Training Center officials also, they are quite supportive. They accept our proposal and they are ready to take it their own as its own. So after we develop, we are going to hand over to them, and still we'll going to continue advocacies, implementations, and even TOT training if possible in near future, so that we can train some of the trainers for the palliative care along with the national health trainings and guidelines. So these all contribute us. And last not the least, be Dr. Rosni and myself, we have contributed a lot of time. So we never thought this project is taken so much of time, because we are so much busy schedules, national activity, international activities, our own government job and other things. So we thought it will something like that. Maybe we can have few hours in a week. Sometimes we work whole weeks collecting the peoples there and collecting and bringing all the expert together. So lots of times. So we have expand lots of time for that project too. So which we thought it was beyond our imagination, but still we are doing. So I think we will do it, we will complete it. That's our motivation from myself. Even Rosni also motivated so far. So that type of motivation and extrovert, which we did not think at that time when we have started. So maybe it is quite easy, and we do have some of the supporting staff, we do have fun, so that we can do it like that. We are in shelter now. We didn't have fund also, we didn't have any support itself. But if we have to ask to do something to by others, it takes longer time. Though that things which we are working in the 1 day or 2 days, maybe other people, if we can onboard them and doing that thing, it takes a week or not. So we decided ourselves also, let's do ourselves as much as possible we can do it, and we have contributed lots of time on that. So that type of supporting hands what I get with the Dr. Rosni, Tweety madam also, that is quite of the other thing. So we are complementing each other. So then I am just taking most of the thing, the doctor's medical content, she's nursing content, and then we are integrating each other and sharing each other and collaborating each other. So that type of collaboration among ourselves also give more strength for us to move forward.
Thank you so much, Dr. Krishna. It sounds like you feel this one of the big successes is how much support you've gotten from government level, WHO, all of your supporters. So what a wonderful success to have is the support from all of these stakeholders who will support you and allow your project and pediatric palliative care to advance in Nepal. So that is a big success. I agree. I heard you also say that maybe one of the things that surprised you was how much time these projects and these advocacy journeys take, with the collaboration, even with your nursing colleagues, and how much extra work on top of your clinical work you are putting in. So I hear your passion and your motivation, which I'm sure is inspiring to our listeners. Maybe lastly, can you tell us maybe something else that has surprised you throughout this journey, whether it was in the leadership program or through your project? What has surprised you as you've been going down this project journey?
Yes, yeah. Again, the motivations, just like what I am getting continuously, that's beyond expectations from different levels, national level, college level, even international. That's push us forward, keep on moving the things and taking the project forward. And on period this, we are quite confused initially whether we can get all this together in so short of time. And then in between, what we realize, really we can finish that project in a year, going to have some shaping of that project within a year. So it's a big challenge, but now we have little bit already shaped that project, so that also is beyond our expectation, because we thought maybe we'll do some part of the project during the year and something like that. So now already we are near to the zero draft, and we are just talking with the training, this government national health training center, this working group, this technical expert group. So we are very close toward the end of the, not the end, maybe toward the initiation of the formal implementing issues of that project. So that's what it quite given. And then other institutions, just like when we invite other peoples who are already have some ideas in pediatric palliative care, so they come together and they boost us, and even they ready to write the topics and different middle. So we get lots of hands to support them initial draft. So we did get that, but most of them may not be have aware of that the national training center guidelines. So we invited them to train them too. We get lots of help to write the topics as well. So that is other things. Yes, initially we thought we do have the some expert team, somebody to hire, something to write the content, something like that we had thought. But later we can get lots of support getting. That's also beyond my expectations. Ultimately, an international support and especially dual cancer collaboration. Though we do not get the financial aid so far, but we just try to help convince most of the people. Okay, we are going to the government officials when we are taking meetings. So everything we can able to do without any financial things for them. So we ask them, we are going to pay in future. So everything we whatever we have done without just like we requesting them, we convince them we will do it in the future. Once we have completed, when we are getting support, we'll support you, we'll recognize your contributions. May not be good, but at least we do so that type of motivation also we can do it, we are able to do it. So that's other things for me in this project, which give lots of expectations beyond my expectations. Sometimes they don't government official, they told is no, you have to give that things maybe financial support, meeting allowance and travel allowance and other things. So they are quite supportive and they accept us is how we are. We didn't have that much of money and not the resources, but they accepted us as we are. So that other things we can able to move forward to. So these are the memory of me, in which I thought these are the surprising about me, how the people they are cooperative, how they are helping to us to complete our project.
Thank you. Thank you so much, Dr. Krishna. It sounds like what surprised you was how the other members of your team and people you brought in, you motivate each other. You motivate each other to continue this work and push each other forward, which I think is a theme in pediatric palliative care and this series of podcasts. Part of the magic of, I think, our work is we each motivate each other because we know this work is important. Thank you so much, Dr. Krishna, for joining us today and sharing your passion and your incredible work that you're doing for the children and families of Nepal. Thank you so, so much, Dr. Krishna, for taking
Okay.
the time to join us today. And thank you all to the listeners. This concludes our series of 4 podcasts where we heard from various people in different parts of South and Southeast Asia, where we heard about their incredible and inspiring and motivating projects to help advance pediatric palliative care in their respective communities. So I hope you enjoyed listening, and we look forward to sharing future episodes in another different series. These podcasts grew from a seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer collaboration focusing on children's palliative care. We hope to build a world where no child suffers from serious, life-threatening, health-related suffering. To learn more about the Sunflower Children's Network or to donate, please visit twoworldscancer.ca. I'm Natasha Datoo, and thanks so much for listening. Take care.